Before we get started, my name's Ellen, this is Swagata. Before we get started, I wanted to get you a little bit involved. I know you've just had a bit of a break, but I'd like to ask you, firstly the lawyers, can we have the lawyers in the room stand up please? Okay, we've got a few, thank you. Can we also have those, please keep standing, you're not out of the water yet. Can we also have those people who are wearing a jacket or have a jacket on the back of their chair? Can you please stand up? Okay. The last group of people, those people who have children or hope to have children one day, can you please stand up? Okay. So we've got quite a lot of people in the room potentially affected. And what I'm asking you to do to stand up here is I'm indicating that there are certain groups, some professional groups like lawyers. Lawyers are tough gigs. Some of them do get depressed. As well as other groups, social economic groups that are particularly affected by mental illness. So there are things that we can look at in our community, people that we can say are in a high-risk category. There are also other people that you don't know why, just like whether you're wearing a jacket or not, you're just unlucky. And you can just as well be affected. So don't think I don't fit in that category and therefore I'm not going to be affected by this. It's just bad luck in many circumstances. It can't necessarily be predicted. And also those people who have children or hope to have children one day, you've got a real investment, a real interest in knowing and understanding a bit about mental illness. Please sit down. But we're going to be trying to be a bit more positive about this and not talk just purely about mental illness. We also want to talk a bit about mental health. And so I'll ask those people who have laughed today to stand up. Thankfully, we've had Dr. Nutcase to help us out here. Also, those people who've had a great weekend. And those people who count family and friends as a really integral part of their lives. It affects a large part of us. Those people, all of you that are standing up, if you have a big investment in family and friends in your community, you laugh, you like to laugh a lot, that you had a great weekend, if you've got the capacity to joy and those type of capacities, you've also got the capacity to build mental health. So we also want to talk about the positive end of the equation. Okay, so a bit about Swagata and myself. I have a background in HR before moving into or being introduced to the mental health area. And when I left HR a couple of years ago, my aim was to try and do my bit to raise awareness of mental health in the workplace. I'd been introduced personally through my family to mental health and became a lifeline counsellor, and through the education of lifeline counselling started to see in my workplace a lot of performance management issues that really weren't performance management issues, they were health issues that we were just misdiagnosing. And unfortunately, quite often what happens with mental illness problems is that the sufferer doesn't understand what's going on with them. So how are they supposed to tell you that this is not a performance issue? They don't understand why they're not performing well. How are they supposed to understand and communicate what their needs are? So the idea was about trying to educate employers about what they could do in raising awareness and education amongst their HR people, their health and safety people, the people that pay the bills and are looking for cost savings to put back to the shareholders, and also team leaders and managers who have to deal with these performance management issues. They have to lead their staff and look after their staff. And in going through that journey, I've worked with a number of community organisations. One in particular is ORYGEN. ORYGEN Youth Health, and Swagata is from ORYGEN, is a fantastic organisation that's based in Melbourne. And I had the good fortune to hear a fully packed Melbourne Town Hall, the community of Melbourne, advocating for why can't we have more ORYGENs? Why does ORYGEN just have to look after a small area, because basically it's a health facility, treatment and education in mental health for our young people? Why can't we have that more open to the broader community? And that's quite rare for a health facility. How many people are really saying we want more of this? They're doing a great job. That's quite a good call. Fortunately, ORYGEN's success means that its reach is actually expanding. Earlier this year, ORYGEN, and in partnership with the Brain Mind Research Institute, the Australian Division of GPs and the Australian Psychological Association, was granted over $30 million to spread its model of mental health treatment and education, which is a small amount of money in some respects, but is, it's better than a slap in the face. It's a great start. Okay, and so I'm really pleased that Swagata, who is has a background in mental health treatment and education, and is really driving within ORYGEN education within workplaces as well on mental health, could join me here today. Now, I guess for have a lot of people seen An Inconvenient Truth? I guess in seeing that, I did sort of feel a bit down. For so much in the movie, we were educated about so much that was going wrong. And yes, if you haven't seen the Change the World book here, have people read that? There's a lot of tips there on how you can do your bit. And I sort of thought, well, I've read that. I've disconnected my video and my TV when I'm not using it. I recycle my grey water. What else can I do? And I guess I wanted to be really clear here that in terms of mental health, there's certainly an enormous opportunity that you can get involved, quite easily and quite directly. And so we want to focus on that positive message, that we can tackle mental illness, that we can not only address mental illness, but we can really promote mental health. And Swagata will talk a bit more about that, what that means.
So I guess one of the things for me, being a mental health professional and having worked predominantly in clinical environments, is that...
Swagata, are you blocking it?
Oh, sorry, is that I am not good at not blocking PowerPoints for a start. But the other thing is that you get used to working in a particular culture where you're used to working with clinicians and people who tend to have a really good working knowledge about mental illness and mental health issues. And for me, one of the things that's been really startling in the work that I've been doing at ORYGEN is in going out to communities and into organisations and into workplaces, that you start to realise that that's actually not a shared set of knowledge, that it's something that can often just sit within a very specialist field of treating mental illness. So I guess what I wanted to start off with was just talk about some of the common misperceptions. And, you would hazard a guess that people here may have a better general knowledge about mental health issues than perhaps the general public, given that you may have self-selected to come to this particular summit. But I guess the first one is a common experience that you get when talking to people, that they believe that mental illness is really rare. Can I just get a show of hands here of the number of people that would kind of hold that view, that it's a rare thing? I'm glad to see that. I mean, I think the media has been doing a really good job around promoting this whole issue of mental health in the media, and people are beginning to become more aware of it. But essentially, mental illness affects 1 in 5, so that's 20% of the population at some time in their lives. If you look at young people, so the age group of 15 to 25, that figure then increases to 1 in 4, so 25% of our youth. And that's a fairly concerning statistic. Another kind of preconception people can have about mental illness is that it only affects the disadvantaged. And the reality is that mental illness doesn't discriminate. It can affect anybody, regardless of your social status, your socioeconomic background, your gender, race, religion. It can affect across the board anyone. What the research does show, though, is that if you come from particularly chaotic backgrounds, dysfunctional family backgrounds, chaotic sort of environments, that you're more likely to have difficulty making a good recovery from an episode of mental illness. So that's again, and I think for us as an audience, if you think about how many people are in this room, then it's likely that 1 in 5 of us have had some experience of a mental illness or are going to sometime in our lives. So it's a fairly common experience. The third misconception is that mental illness is a lifelong problem. This is absolutely not true, and I think this is one of the misconceptions that has fueled a lot of fear and anxiety about the whole issue of mental illness. The reality is that a number of people will just have one only episode of mental illness, of depression, of psychosis, of an anxiety attack, and never experience another episode again. And the reality is that not only do people suffer only one episode, but people make a really good recovery as well. So recovery is actually expected for the vast majority of people, which is another issue that people don't seem to have a sense of, is that I think it's promoted in the media that if you develop a mental illness, that's kind of it for you. It's really going to be downhill from here. So I really want to drive home the fact that it's living within us in the community on a day-to-day basis. It's something that many people will experience, and it's something that people make really good recovery from. And I guess the other thing to really focus on is that people with mental illness can be incredibly productive employees and are incredibly productive employees, and that we can actually do a lot about not only treating mental illness, but about prevention and also about promoting our own mental health and developing organisational systems that support people to maintain really good mental health. So I guess, how do we do that? One of the things I wanted to talk about was the idea, I thought, a model of a bank balance. That when someone is suffering from some sort of a mental illness, they're likely to be in the red, so they're really struggling either perhaps with depression, anxiety, having difficulty getting out of bed, having difficulty concentrating. They're not doing so well, and their resources and their reserves are at a real low. And what happens at that point is that if that person's really lucky, they'll get to some treatment, bring in the experts, get people who have got really good background in terms of working with mental illness and mental health issues to come and assess what's going on for you and to provide the evidence-based treatment around what's happening, around the symptoms, around the behaviours. And that will usually bring people up into this neutral bank balance. And that's kind of when, you know, your acute symptoms have resolved and you're feeling just back to a very baseline level. But the reality is that, can I have a show of hands of anyone here who's really happy with having a bank balance at zero? No one. And I mean, that's the reality. We're not happy to sit at a zero bank balance in terms of our finances or indeed in terms of our mental health. And so there's a whole range of activities that people can be involved in terms of developing their mental health, promoting their own sense of health and well-being. And we can think about it in terms of, people are much more familiar with the analogy of physical health and the sort of models that are used in education about physical health. So is everyone familiar with the sort of campaigns, promotional campaigns that are done around diabetes, around heart health, around exercise? So they look at all of the activities you can get involved in to promote and prevent further issues in your physical health. You know, eat healthy, lower your cholesterol, make sure you're getting a good diet, meditate. And that's the same sort of analogy that we use when educating people about mental health. So when you get to your neutral bank balance, what can you actually do to push yourself up into having a positive balance and some reserve? And that's something that we'll go on to talk about a little bit further on.
So what does this mean for an organisational perspective? I guess from an HR perspective, you know, if you've read the Jack Welch books or what have you, quite often in managing people, we sort of look at our star performers or our A players who are really driving the organisation and they're really firing. We sort of look at how do we give them more resources? How do we actually, they're running the organisation, they're driving, so they're getting the results. What can we give our A players to keep on firing? And we identify our B players who are doing okay, but have the potential to do so much more. What can we invest in them to bring them up to be A players? And again, our C players, let's face it, they're not contributing to where they should be. We've either got to manage them up or out. Okay, and I guess from a performance management perspective, identifying those C players in an organisation usually are those people who are struggling in their performance. Now, quite often, I think some of those performance management problems, if you like, are often undiagnosed mental health problems. And if we actually were better educated to be able to pick out those C players and not just add to their stress and give them a written warning, but actually identify we've got a health problem, then we can better get them up to a B player and then an A player. Okay? But I guess also it's not just about looking at fixing mental illness, it's also about encouraging, fostering mental health. Our A players, or our people that are really healthy now, just living makes you vulnerable to physical illness and mental illness. And so we also want to make sure that they have the tools to build on that resilience and prevent mental health problems as much as possible. So those same rules apply. It's about treating the illness, but building up into health and resilience. And those skills that Swagata would use in a treatment and education of sufferers and their families also applies to the workplace. In our experience in training organisations, by learning those skills, you can actually train people into that high green bank balance, if you like, about building their reserves for mental health.
Can we just leave it at that?
Yep.
Okay, so I guess in a way it sounds pretty easy. It sounds like, there's some really effective solutions out there. But actually, relatively it is. There's been an enormous amount of research that's been done into the best evidence-based treatments around the range of mental illnesses. And unfortunately, whilst you see mental health and mental illness issues in the media, it's often not a really well-balanced view that you would get. So has anyone heard in the last month of a really positive success story in terms of someone making a great recovery from a mental illness? Yep, great one. And what was that one? Yeah, fantastic. So, and one of the things that I've noticed in the 15 years that I've been working is that that's something that's slowly changing now, and that's a really exciting thing from my point of view. And historically, what predominates in the media are the kind of psycho-killer kind of, the psycho-killer kind of stories around mental illness and the violence and, people doing really horrific things as a result of their mental illness. And we hear a lot of sad outcomes. We rarely hear those positive ones, so I'm really pleased to hear that, you've noticed something that's come up in the media, in the mainstream media. But I guess one of the issues is that what happens is that because of the level of media coverage that's negative and public perceptions around mental illness and the stigma related to that, you'll find that when you speak to consumers and carers who come to you for support, that they have been really reluctant to seek help around mental health issues. So they might have identified fairly early on in the piece that something's not quite right. But the current research, particularly around, say, psychosis, indicates that it's up to 3 years between when someone notices that something's not right to when they actually get to an appropriate service. And that's an incredibly long time. If you think about the physical health analogy, I can't think of anyone who would suffer the symptoms of a stroke who would wait 3 years before they actually came to a service. So that's a really alarming thing for us, and it has a real impact in terms of help seeking and how quickly people get treatment. So the range of treatments that are available, psychiatric medication, so there's a whole range of medication that people can be treated with for the range of disorders. Psychosocial interventions, so interventions around people's housing, their social supports, their family supports, and also a range of talking therapies, and cognitive behavioural therapy is one that's really well received. The key messages, how are we going for time? Am I blowing on? The key messages are that early identification and referral leads to early treatment. Makes sense? And that's why it's incredibly important that every single one of us has a really good awareness around mental health issues. So, as you know, it can touch anybody, and it's really important, whether it's for ourselves in terms of seeking help or in terms of supporting someone else in our families or in our workplace to seek help and support. Really important to be aware of signs and symptoms. And all of the evidence suggests that early treatment and proactive treatment leads to quicker outcomes and better outcomes. So a better level of recovery for people and quicker recovery, which has got to be fantastic in terms of our organisations and our staff working within them.
Okay. Sorry. So just in terms of identification, to elaborate on that point, I guess in my circumstances, I had a definite trigger, if you like. My brother went missing about 5 years ago, and so my family and I were sent into chaos. And so I reflect back on that time and say, yeah, well, that started it. Hurtled into anxiety, hurtled around for about 2 or 3 years until my body just couldn't cope anymore and I collapsed into depression. And if you look at this slide, basically this shows the burden of not identifying that problem. That we don't see people dying. The suicide rate is certainly an enormous concern, but it doesn't have the same death impact that a lot of physical illnesses have. But you have people bumbling around in this fog of illness and suffering, which is taking away from their everyday lives. Now, from an organisational perspective, that means that people's relationships can break down, they can be struggling to maintain their home and so on, but if they can just keep coming to work, they can keep coming to work and just turn up, So they may not be absent, but they'll suffer from presenteeism, where they're just not as productive as they could be. That's the type of cost that is affecting not only them, but also our organisations. And that is an enormous cost. Swagata has referred to the 1 in 5 and the 1 in 4, and that translates into a cost just in terms of depression. Forget the other mental illnesses, and there's plenty of them, but just for depression, that's 6 million workdays lost per year, or another 12 million workdays lost in presenteeism, of turning up but just not functioning to full capacity, which equates to a dollar value of about $500 for each and every one of us, for each employee, not just the ones affected. That's an average across our workforce. So that is a significant cost which could be brought back if people were properly educated.
So if you extrapolate out the costs, you can see if you're looking at these organisations potentially what the costs might be to organisations of not only absenteeism but presenteeism. And I guess, when Alan and I put together this presentation, we were really putting a focus on, the actual financial burden and cost. But I would also like to add in there, someone asked the question really early on this morning about, what is the philosophical and moral imperative for us to be paying attention to this? And I can't resist, sorry, Alan, I've just got to add in that from a mental health professional's point of view, we've got a really strong moral and philosophical imperative to be looking out for these issues in terms of ourselves, our families and our community. So one of the issues though that can come up for employers is that by addressing this, am I suddenly taking on responsibility for the mental health of all of my employees? What does that mean for the organisation? Are we going to be able to deliver the bottom line still? And a number of those sort of issues. And you're actually not responsible ultimately for the mental health of each of your employees. That responsibility sits with each employee themselves. But what you're able to do is become really clear as managers and team leaders and the executive and people within the organisation about what your mission is around that. And this is an example of how one leadership team actually articulated for themselves and those entering the training program that was provided, how to tease out the different aspects of who was responsible for what and what their commitment was as an organisation. Sorry, am I fading in and out? No. Okay.
Okay, so in terms then of once you've got the philosophical underpinning that's going to drive this, how do you actually do it? And I guess that, to try and keep it short because we are short of time, is to say that the systems already exist. Most organisations already have health systems, they already have performance management systems. And if you just expand your context about that, you can use your existing systems of identifying the signs, recognising the signs in terms of people's demeanour and their performance and so on, using the initial support of educated HR and OH&S people who will think beyond a performance issue to think that it could potentially be a mental health issue, and with education then they can appropriately respond to that. But then there's also a whole raft of other support mechanisms that are available in the community. Australia Post is a perfect example, who've really led an initiative by partnering with Men's Line, an Australia-wide counselling support service particularly aimed at men. So the systems already exist there. And through education about the signs and symptoms of mental illness, about mental health and wellbeing to maintain and build resilience and maintain good mental health, about where to go and the systems that are available for your team members, for your managers and for your HR staff, that has actually enormous impact on an organisation to be able to respond to this community issue. We'll just skip through this, but perhaps if we finish with this slide as a model.
I was actually going to say maybe skip through that and go to the next one.
Okay.
In terms of the benefits.
Yep.
We're just going to give you a little bit of information about the sort of things that are covered in that training package. But I guess the bottom line for you is that no one's prepared to invest in things unless they know the bottom line is that it's really effective. And we've done some really comprehensive research around the outcomes of education and mental health awareness programs, and these are the outcomes that you've seen. So really fantastic outcomes. Not only improved knowledge about mental illness and mental health, that improvements in health behaviour, so how people in the organisations actually look after themselves, improvements in people's confidence to deal with mental health issues in themselves and in others, and an improvement in attitudes to people with mental illness. But the most important one is improved mental health in those who did the training. So the outcomes were that people within each of these training programs were able to subjectively say that they had a much better outcome in terms of a much better mental health at the end of this training session, because they were able to put into place and into practice the things that they were learning on a day-to-day basis.
And if you translate that into a physical health context, we all know that we shouldn't be putting in fatty foods into our mouths. We all know that we should be exercising more. These are lessons that we've learned in terms of our physical health. In terms of mental health, there are other lessons that you can learn and are very hard to unlearn. We can't unlearn that exercise is good for us. There are other mental health lessons that are also very easy to learn, very easy to put in practice, and that stay with you to make sure that you build your mental health. At the end of these slides, there was an audit which is available on the website that you can go back to your organisation and say, have we got this in place? As sort of a checklist. So we hope that you may be able to refer to those to be of more assistance in practice as you consider these issues.
Did you want to put up? There's also both of our contact details on the very last slide if people want further information as well. And I guess, can I just make one parting comment, is that, I would be really pleased if people can take away with them just thinking about how any of those concepts can be applied to themselves when they leave here, and that would be kind of our job done in some ways.